Hi everyone, welcome back to our second part of our coding for this week's Integumentary System Review, looking at procedures. Okay, so I've started up here on the board. We have 7 characters and we want to look at the exercises in our textbook for Integumentary System, which are found on page 300 through 302 of your textbook. So let's do some code building exercises together. I'm going to do 2 of them with you. And I want you to look through the other 2 before you start this week's assignments. And you can look in the back of your textbook in Appendix B for some of those answers to verify your work. So let's do 1 and 2 together. Our first one, for exercise 1, has 2 different diagnoses. We have a preoperative diagnosis of an abdominal wall abscess and a postoperative diagnosis of an incisional abscess. So we want to make sure we read through the entire note. Keep in mind that the final diagnosis is going to be what's going to drive the type of procedure we're doing, not the initial. So in this case, the fact that this is an incisional abscess will tell us a little bit about what we're doing. The procedure itself is called an incision and drainage of an abdominal abscess with excisional debridement of a non-viable skin, subcutaneous tissue, and fascia. So we want to start off by saying, well, we know it's a medical and surgical procedure, and if we go into the subcutaneous tissue and fascia, we can remember from guideline B3.5 that we're going to code to the deepest layer. So if there's parts of the procedure that are done in the skin as well as to the subcutaneous tissue, the code will be with J, not H, because the J is the deepest layer. If there's 2 separate procedures, we would code both based off of multiple procedure guidelines. Let's keep reading. The indications is a patient who is a 60-year-old male, initially had a sigmoid colectomy for diverticular abscess, came in about 24 hours ago with pain across his lower abdomen and an oozing incisional site. A CT was done and confirmed an abscess beneath the incision. So this is why they came up with the term incisional abscess as the final diagnosis, because the abscess now is from the incision, not just to the wall. The patient is found to have an abscess that went down to the level of the fascia. So right now I can continue my code and say J. The interior layer of the fascia was fibrinous and some portions necrotic. Okay, this was excisionally debrided using a bovie cautery and scalpel. So here they're telling us that they've excised the abscess itself. And so if we remember the definitions for excision and resection, we can remember that excision will be appropriate. And so we're going to start our code with 0JB because we're excising tissue from the subcutaneous layer. The further details tell us about the technique. Patient was identified, then taken to the operating room after induction of anesthesia. The abdomen was prepped with a betadine solution and draped in a sterile fashion. This is all just telling you that they were in good health. This is clinical information that's important to say how were they laid down, how did they move, but it's not necessarily as important for us in our code selection. The wound opening where it was draining was exposed using a curette. The extent of the wound, okay, so a curette is a little tool, so they're exposing it, meaning it was already cut. The extent of the wound marked with a marking pin and used a bovie cautery. The abscess was open and evacuated. I then noted that there was significant amount of necrosis below this. Bovie cautery and scalpel were used to remove the necrotic fascia. Okay, so again, paying attention to what layer of the skin, making sure we didn't go into the muscle. The wound was irrigated, and after achieving an excellent hemostasis, the wound was packed in antibiotic-soaked gauze. A dressing was applied, patient tolerated the procedure, and was taken to the recovery room. So is there a guideline that helps us determine the body system involved? Yes. If we remember from B3.5 that we talked about a moment ago, the guideline that helped us was the guideline telling us code to the deepest layer of the skin. In which body system is the procedure coded? Again, we're looking at the subcutaneous and fascia tissue. And now to look up our code for the assignment, we know we're going to start 0JB, but we want to look at that, and I'm going to pull this up under 3M in my online access using my iPad here. Those of you that have 3M at home, you should have already done the exercise earlier in this module, and so the coding encoder is still available to you to use for this if you prefer over your PCS book. I chose to do this today because I wanted to show you guys a little bit of both throughout these videos. So when I start in 3M, I'm going to add a procedure. I'm going to, of course, start off my patient as 33-year-old unspecified sex. Code finder as opposed to DRG will help me to just kind of get into the code I want to look for. When you're doing 3M as a practice for your work, you may use it in different methods, so keep that in mind. Enter the keyword or code. So I remember that this is an excision. Even though this started as an incision and drainage of an abscess, they actually excised the tissue. And so the full procedure, an incision was already there. It was already an incisional abscess. And any kind of drain that's done as part of I actually didn't see any of it saying that they did a drain. So they may have gone in with the intent of draining it, but they actually said here the abscess was opened and evacuated. So here, to confirm, we have B. We're going to start with the term excision because that was what was done, not an incision and drainage. Okay. Now under 3M, I have three options. I have excision, excisional biopsy of tissue, or excisional debridement, cutting out tissue. And in fact, it has a question mark next to it, which I can look at, and it can tell me all the detail about what is included in an excisional debridement. Cutting away of necrotic tissue, of decubitus ulcer of the heel is one of the options here. Excisional debridement of various different areas, and it gives me some coding clinic information. Now I know that this is going to fall under the term for surgical removal or cutting away of tissue, necrosis, or slap. So I'm going to say yes, excisional debridement. What did we excise? Now remember, our character was J because we were in the subcutaneous tissue and fascia. Where was it located? I have options of head, face, and neck, lower extremities, sacral region, trunk, and upper extremities. And if you look on here, if I select the trunk and go to abdomen, continue, no additional areas, no additional sites. I'm going to get the code 0JB80ZZ. And this is telling me that we have an excision of abdomen, subcutaneous tissue, and fascia, open approach. And so this is the abdomen that we were at. And so the last is 80ZZ. Okay. Now keep in mind, if you remember your layers of the skin, how do we know that this was an open approach? Because they went through into the fascia. They went through the skin. So even though there was already a procedure done previously, the approach is still open for exercise number 1, and this should be accurate. So if we check that, that will be correct. Let's look at number 2, and then I'm going to let you guys do the rest of the coding practice exercises in your own. So we'll clean this board here. There we go. And count out our characters. 1, 2, 3, 4, 5, 6, 7. Okay. There we go. Okay, so code number 2. Scenario is a patient who has completed their course of IV antibiotics and their tunneled catheter into the superior vena cava is no longer needed. In the surgical suite, under an ultrasound guidance, the subcutaneous cuff off the old catheter is dissected and freed using the hemostat under the skin. The entire permacath catheter and extension were removed. Okay, so we have a couple of things here. And let me just go ahead. I'm going to set up my patient here just like I did before. So I have a 33-year-old patient. and they are no sex, and we're looking at the information as, let's see, code finder. And there we go. Sorry, I messed up here. Okay, so we have here a very short scenario. I have my patient pulled up for my code finder so I can look at adding procedure, and I'm ready to get started. But you notice that I put 2 codes on the board because we're doing 2 separate things. The first thing that we're doing is we're removing in here the device, which is the tunneled, tunneled catheter in the superior vena cava. Okay, and this is going to be a removal of a device through the skin, but also we're also going to be looking at, let's see, the infusion, course of antibiotics, there's a subcutaneous cuff from the old catheter is dissected and freed, and the permacath catheter. So there's 2 different things. There's one device being removed from the actual subcutaneous layer, and one of them that's being removed from the supravena cava. And so if you're looking at your various different areas, you're looking at a device from one of the greater vessels, which is the superior vena cava, so you remember heart and greater vessels, as well as removal of a device from the skin. So because we're doing 2 different procedures to remove this entire device, even though it's all one surgical setting. Okay, so from which body systems are the catheter and tunneled extension removed? That's going to be your subcutaneous fascia, because it says here, subcutaneous cuff, as well as your greater vessels. What device values are associated with these devices? Okay, so we're going to look at that in the code book because we want to find those devices and figure out what codes are assigned. Okay, so our device values are going to be 3 for infusion device if we look at the device values that are available for this table. Okay, so let's get started. We're going to be removal, which is going to be medical and surgical. And if you remember, removal is going to be root operation, P as in Paul. Okay, and so we know we're going to have 1 for J and 1 for the greater heart and vessels. And if you look that up, you'll see that that is for character 2, which we haven't yet gotten to, and that's okay. You will get to that later on, but it's important to identify this now. Okay, so I'm going to go ahead and add this into my 3M, and I'm going to start with the term for the procedure, which is removal, because that's my root operation. So I'm going to be removing. I get the option for removal, and I'm removing what? I'm removing a device. You'll notice there's various different options. And so when you're looking at it, you have a regular device, such as a drain monitor or traction device, versus a joint device and other devices that you can spell. So I'm going to go with device here, and it's going to ask me what type of device. Without incision or puncture. Let's see. Nope, that's not what I want. Removal of, I'm just going to spell the device here. So sometimes the easier way when using 3M is to spell the device, just as you might be doing in your PCS book. Here, I want to spell the device, and I'm going to start here first with my subcutaneous catheter. And I can write that on here. And I want to look at exactly what was taken off. Okay, so I have the option of catheter versus catheter tip if it was fractured. And there's a little question mark if you're looking in 3M with me, you'll see the question mark and you can read information about that. So if it was just a catheter tip, it would be extraction because we would be taking it out. In this case, that's not what we did. We removed the actual catheter. Okay, and what type of catheter? It was a venous catheter or a vascular. Let's look at that. So in this case, where did it go? Was it the superior vena cava? I always like to verify superior good. Always like to verify my areas, even if I think I know where it's at, to make sure I'm in the right area. Okay, and then what is the approach? The first thing that we looked at was the superior vena cava, which was removed. Let's see, under ultrasound guidance, subcutaneous cuff off the old catheter was dissected free using a hemostat under the skin. Okay, so in this case, I'm going to go ahead and select that this was percutaneous approach, and I'm going to come up with the code 02P-Y33Z. So 02P-Y33Z. Now that one actually is for the superior vena cava. I can also add an additional, no, it was not replaced. Okay. Add additional procedure, and I'm going to do the same thing. So what am I doing? I'm removing a device. From the subcutaneous layer. Okay, where was it located? This is going to be in the trunk. And what type of device? I have the options now: vascular access device, totally implantable, versus vascular access device tunneled. And so I'm going to select tunneled here. And then again, we get to the question of what was the approach, and we're going to still stay with percutaneous. And we're going to come up with code 0JP, which we already had, T3XZ. And this is for tunneled vascular device from the trunk of the subcutaneous and fascia, percutaneous approach. Okay, so that's it for our question number 2. Go ahead and try questions 3 and 4 on your own and see what you come up with. You'll notice that there's 2 codes in each of these. It's important with number 3 to identify exactly what are the procedures that are being done and what's included in each of those procedures. Remember that you may have the removal of a procedure included if it would typically be removed as part of the main procedure. However, for issues with 3 and 4, if they're involving any kind of replacement where an excision was made to another area to use a skin graft, you'll want to code both the excision and the final procedure. That's all that we have for today. I'm going to go ahead and leave you with this, and if you have any questions, feel free to send me a message via email. You can text me for anything urgent, and if you have any issues with coding, make sure you send those to me and we'll review it together. Until next week, have a great time.